We're back now at 8:10 with an increasing number of thin women who are choosing to have liposuction. Here's NBC's Kristen Welker.
Nicole Silva maintains a size 2 figure, so would you believe she is about to get liposuction?
I love my body. I'm very comfortable with my body. I don't think that it's bad at all. I just know that it can be better.
A model since she was 15, Nicole says a little nip and tuck around her thighs, which she considers to be her problem areas, could really help her bottom line.
I'm getting older, so it's a lot of pressure to stay young, to stay fit, to stay thin, and to stay, well put together, because there's someone that's right behind you that wants your job just as badly.
But it's not just for people who grace the covers of magazines. Last year, more than 200,000 people got liposuction. The majority of them, women.
It seems like every other patient that I'm seeing for liposuction is a thin, fit patient.
Beverly Hills surgeon Dr.David Amron says liposuction reproportions the body. It doesn't make someone skinny.
Somebody can be thin, like Nicole, and have stubborn, disproportionate areas of fat, and that can be a perfect candidate for liposuction. It's all about my role in terms of rebalancing her body. Hi, Nicole.
Nicole is seeing Dr. Amron for a procedure called Mini-Liposuction, which targets 1 or 2 small areas. The surgery is far less invasive than traditional liposuction, and the whole procedure takes about an hour.
We're done.
I think you just have to watch out that when you start fixing flaws that nobody but you can see, you might end up with the kind of body you're never going to be happy with.
Cindy Levy of Glamour magazine worries quick fix solutions like mini liposuction reinforce the idea that all women should strive for perfection.
You need to make sure that once you've had the surgery, you're not going to say any other little flaw that crops up, I'm going to fix that too, because whew, that's a slippery slope.
Liposuction in any form is still surgery, and it continues to raise complicated questions about how far is too far in the search for beauty. For today, Kristen Welker, NBC News, Los Angeles.
Dr. David Amron, who you just saw in that piece, is a dermatological surgeon in Beverly Hills. Belisa Vranich is a clinical psychologist. Good morning to both of you.
Good morning. Good morning.
People are watching this right now. I think they're thinking Nicole's a beautiful young lady. She's the last person on earth who needs liposuction. Is this a case of people who are going to just chase perfection too far?
Well, there's so many misunderstandings about liposuction, specifically the surgery, and it really has nothing to do with being overweight or being out of shape.
It's not weight loss.
It's not weight loss. That's one of the misunderstandings. Weight loss is the patient's responsibility. My responsibility as the liposuction surgeon is to balance a person's body. And Nicole is a thin person. She's in shape, but she has some genetically disproportionate areas that she always struggles with.
Are you comfortable with this? I mean, she has some genetically disproportionate areas. Is this the same thing as whitening your teeth?
Well, I'm a big teeth whitener, so
right,
I mean,
okay.
I don't know if you're asking the right person, but as a psychologist, when I have a patient that wants to go get some liposuction or some mini liposuction, we have to talk about some psychological factors that are in there. And is it a quest for perfection? We look at that because, as you heard, it's a slippery slope. Is it a quest for happiness, which should be done somewhere outside of a surgeon's office, maybe in addition to the surgery? Is it an event, or is it an age that is making you go in for the surgery? So once you've talked about all that, if you want to go in and get that one little problem area done, it's not a bad idea.
Do you tend to see people like Nicole over and over again? In other words, once they get that one little area done, is it off to the next little area?
Well, possibly. I mean, people have to do things for the right reasons, and when I identify a patient as doing things to replace some sense of internal happiness, I'm concerned about things. No external thing is going to necessarily make somebody happy. It's not a shortcut to happiness. That's going to come from somewhere else, from the way a person lives their life, for example.
So would you say no to someone if you get the hint and if the red flag goes up that this is about trying to win back that guy as opposed to just being more comfortable in your body? Would you say no, I don't want to do this procedure?
Well, I'm a technician. If I see somebody as a candidate and I feel that liposuction is going to make an improvement, I will probably want to do the surgery, but I also want to make sure they're in the right mindset for things and not be using it to replace some sense of internal happiness.
And they have to understand exactly what the outcome is going to be. It's going to change your body. It's not going to change your personality or your life.
You have to be realistic. I might be the person saying, no, until you fix this psychological theme, you shouldn't go in for the liposuction. And once you do, if you still want it, go ahead.
But New York Times had an article about liposuction. They focused on a new study that says if you gain weight after liposuction, it will redistribute to other parts of the body. Is it possible that you maintain the flat stomach, but you actually gain weight in other areas?
Okay, I reviewed that study extensively, and it brings up a number of important points. First of all, it was done on only 14 patients that had surgery. But one thing it didn't really mention is how those patients, and if they were evaluated for disproportion, and they really weren't. For example, I don't ask the patient what they want to do. I determine as a surgeon what really should be done to rebalance their body out, because if you don't do that, you run the risk of throwing somebody out of balance and proportion, and that's what happened in that study.
All right, Doctor, thank you. Belisa, thank you very much. Interesting story, and we're going to be talking more about it, I have a feeling. Up next, the woman who lost her memory in a bizarre accident. That is right after this.